Good morning, ma'am. Good morning, classmates. Group 3 will report lesson 3.2. We will discuss here about the commonly abused drugs and its pharmacological effect. The first to report is Honey Grace Malate.
So for the learning outcomes at the end of the topic, the students will be able to identify the commonly abused drugs and know its pharmacological effects. First is hallucinogens. Hallucinogens are drugs that alter the user's thinking processes and perception in a manner that leads to significant distortions of reality. These drugs affect one's perception far differently than many other types of drugs do. Some individuals experience synesthesia, mixed sensory experience such as seeing sounds or hearing colors. Other common effects produced by these drugs include hallucinations, an altered sense of time, and dissociative experiences, example, not feeling connected to one's body or reality. So, ang hallucinogens amo yan mga drugs nga nakapagpabaguhan mga tawan era behavior mga butang nga nakapalibot ha era. Next is LSD or the lysergic acid diethylamide. So ano an adiha ko ha LSD is a semi-synthetic alkaloid substance extracted from a fungus which is grows on rye, wheat and other grains. On its original state, it is odorless, colorless, tasteless. And street names is Lucy in the Sky with Diamonds, Wedding Bells, Acid, White Sugar, Lighting, Cubes, and Brain Eaters. How it is taken is leaking or sucking or alley. It can be in liquid or powder form. It is often put on sugar, cubes, toothpicks, aspirin, crackers, stamps, or bread. Its physical effects dilates pupil, flushed face, increased blood pressure, lower temperature, profuse sweating, nausea, and rapid heartbeat. So LSD is used as a treatment of anxiety, depression, and addiction. So didi and mostly students or youth nagamitan LSD para an era depression bagan maibanan bis labang kadali or else na addict na ini asya sometimes na addict ini hiraki tungo they feel depressed ha era mga pinubuhat especially school kaya napapressurean mga school works nan sering pa diri laha school but ha era gihapon na live. So on psychological effects han LSD is vivid hallucinations, confusion and blurring and of sound, taste, touch and smell sensations. Next is loss of depth and time perception, decreasing ability to perceive danger and to make sensible judgments. Next is builds up tolerance for the drug, requiring an increased dosage to produce desired effect. Acute anxiety or depression and recurring hallucinations or the flashback may occur days, months, or years after the last state. Example, impaired memory, mental confusions, and difficulty of thinking, psychological dependent developments. So, on dangers and LSD is in very small quantities of LSD may cause hallucinations lasting for days or repetitive psychotoxic episodes may recur months after injection. The next danger is may cause an abnormal amount of breakage of chromosomes of the white blood cells that carry genes that transmit hereditary traits or hereditary traits from parents to offspring. Panic reactions to hallucinations have occasionally culminated in suicide. The next hallucinogens is marijuana. So what is marijuana? It is a dried flowering or fruiting top of the plant Cannabis sativa, commonly known as Indian hemp. Usually looks like fine green tobacco. So ang marijuana, amo ini ang pinaka-common nga addictive drugs. Mostly ang mga nagamit ini ang marijuana is mga young people. It ira ini feeling is pag nakaka ano hira ni nga drugs is feeling nira high. May da mga nagamit in marijuana nga sige lang ini it iratawa napapansin ito tas pagat mababawlat era kaligayahan ba pag nakakatake hinirahin ko anhin hinay nga marijuana. Tas may daliwat after they take that marijuana, nagugutom hiragos na magkinaon, tas an ibaliwat, tas an era throat, baga nagmamaraba, ka asya gusto nila uminom matugnaw nga tubig, nabibiling talaga tera after they take that. So an ko an liwat, an street name sa marijuana is Mary Jane, Flower, Pampapogi, Brownies, Damo, Point and Joint or Dub. Marijuana is taken smoked in pipe or cigarettes or can be in food. Hashish is sometimes made into candy, sniffed in powder form or mixed with honey for drinking. Its physical effects is faster heartbeat and pulse rate and bloodshot eyes. Amo ni an namumula ang mata, di ba? It dries mouth and throat. Amo na inanaksin na rin nga gusto nila mo namin tubig nga matugnaw. Altered sense of time is disorientation, forgetfulness, and inability to think. Impaired reflexes, coordination, and concentration. Last is acute panic anxiety reaction. And long-term effect liwatini is chest pain, irregular menstrual cycle, female, if not ikya. That's temporary loss of fertility for both sexes, premature babies and low birth weights, cancer, example, marijuana burnout, dull, slow-moving, and attentive and unaware of surroundings. And toxic effects of what is feeling of well-being accompanied by an increased feeling of physical strength and general euphoria. B is stimulation of the imagination followed by a deleterious state characterized by kaleidoscopic vision. Next is a state of general motor weaknesses, fatigue, drowsiness, and sleep. Next, extreme talkativeness. Next is impairment of intellectual capacities, particularly which govern speed and accuracy, irritability, confusion or fear, and impulsive behavior, variable mood reactions, and lastly, experiences of phantasmagoria, the sensation that figures are rushing toward him at tremendous speed, increasing in size as they approach. Endangerhan marijuana is slow down users' mental and psychomotor activities, creates health problems related to the reproductive system, heart, lungs, may lead to cancer, and psychological dependence develops. The next report will be discussed by Aura Lumen.
Sedative hypnotic drug, chemical substance used to reduce tension and anxiety and induce calm, or to induce sleep. Most sedative hypnotic drugs exert a quieting or calming effect at low doses and a sleep-inducing effect in larger doses. Sedative hypnotics are distinctive in their selective ability to achieve their effects without affecting mood or reducing sensitivity to pain. Sedative hypnotics, amoy ni ang mga ginagamit na chemical para maibanan ang pagkabalisan sa mga tao, para maging kalma. Ginagamit gyap ini mga pampakaturog nga kung gusto kumaturugin maiyak or di rin nakakaturugin maupay. Okay. Alcohol. What it is. A term applied to members of a group of chemical compounds, specifically to ethyl alcohol or ethanol compound, which is the main ingredient of all alcoholic beverages. Trade names: beer, whiskey, gin, and brandy or wine. Effects in general: sedation. Sedation, mga pampakalma na, mga ginagamit sa hospital na yung tuturok bago mag-opera para di feel it all. Letter B. Impairs mental and physical functions. Nakakaruba pansakob ng panggawas na alawas. C. Letter C. Increases the risk of heart attack and stroke. Dako ang chance na ma-stroke ang usa nga tawo. Dangers. May lead to cancer of esophagus, intestines, pancreas, thyroid, and breast. Addiction. Letter B, addiction. Letter C, cirrhosis, brain damage, and obesity. B. Barbiturates. What they are? Made from barbituric acid called barbs, they are prescribed to induce sleep or in smaller doses to provide a calming effect. All are legally restricted to prescription only. Barbiturates are dependents producing both psychic and physical with variable tolerance. Signs of physical dependence appear with doses well above the therapeutic level. Street names: Lily, Bala, Donors, Yellow Jackets, Rainbows, and Blue Heavens. How taken: orally as a tablet or capsule, sometimes intravenously. Effects in general. Um, in small amounts, make user relaxed, sociable, good humored. Ginagamit an ginagamit it mga user ini para hira ma-relax. Letter B. Heavy doses make him sluggish, gloomy, and sometimes quarrelsome. Ang mga amoy niya na mabubugat na doses and nagdudulutin kaluyahan halawas. Letter C. Staggering gait, thick speech, sedation, and incoordination are progressive with dose. Dangers: sedation, coma, and death from respiratory failure. Inattentiveness may cause unintentional repetitious and administration to a toxic level. Death from unintentional and intentional overdose. Causes physical as well as psychic dependence. More than milligram per day can lead to barbiturate poisoning, physical dependence, and possibility death. The next is narcotics. Narcotics, also known as opioids. The term narcotic comes from the Greek word from stupor and originally referred to a variety of substances that dull the senses and relieve pain. Though some people still refer to all drugs as narcotics, today narcotic refers to opium derivatives, and their semi-synthetic substitutes. A more current term for these drugs with less uncertainty regarding its meaning is opioid. Examples include the illicit drug heroin and pharmaceutical drugs like oxycontin, Vicodin, codeine, morphine, methadone, and phentermine. Um, Narcotics, mga substance na nakaka-apekto hit mood or behavior ito sa katao. Types of narcotics are the codeine. What it is? A component of opium and derivative of morphine. It is 10 times less effective as morphine dose-wise. Physician choice as an ideal antitussive, and it is found in cough syrup. Street name: Schoolboy. How taken? Orally in tablet form and can also be injected. Effects in general: analgesic and cough suppressant with very little sedation or exhilarant action. Dependence can be produced or partially supported, but large doses are required. Letter B. Morphine. What it is? The principal active component of opium. It comes in white crystalline powder, light porous cubes, or small white tablets. Morphine ang pangunahing ginagamit bilang isang gamot sa sakit at pwede gihapha mga gamiton bilang isang sangkap para gumawa ng iba pang ipinagbabawal na droga. Street names: M, Dreamer, Emma, Emcel, and Pulbus. How taken? Any route, but mostly by intravenous injection. Effects in general: initial reaction is unpleasant to most people, but calming superseds and depending on dose, may progress to coma and death from respiratory failure. Dangers: sensitivity to respiratory depressant effect until tolerance develops. Psychic and physical dependence. Tolerance develop quickly. The next to report is Lawrence Espinosa.
Oh, hi guys. I'm the one who assigned to discuss this topic, letter C, heroin. So what is heroin? Heroin is a chemically known as diacetylmorphine. It is a white, off-white or a brown crystalline powder. This is the street names of heroin. It also called blanco, brown, sugar, kabayo, kengkoy, gamot, matsako, pulbos, sapsapat technique. And how it be taken? It taken orally through inhalation, injection, or by smoking, referred as chasing the dragon. However, intravenous injection is the most common method used. So, effects in general, letter A, tracts and smallness of the pupil of the eye. Letter B, slowing down of physical activity and relaxes slurring of speech. Bluish discoloration of skin, non-oxidation of blood, dry and itching of skin, brittleness. And letter D, dry mouth or excretion of body fluids slowed down, droppy eyelids. And next one is letter E, lowered blood pressure, flushed complexion, dilation of facial blood vessel. Letter F is lowered skin temperature and cold skin, also called that hypothermia. Next one is letter G, decreased propulsive activity of the intestine, constipation, infrequent urination. And the last is letter H, lack of air to the lungs and excess sugar in system, also called hyperglycemia. And what is the dangers of this? Letter A, dependence usually develops more rapidly. Letter B, sensitivity to respiratory depressants effect. And letter C, dependence liability is high. Stimulants are a group of drugs that result in increased activity in the body. These drugs are frequently abused due to their performance enhancing and euphoric effects. Stimulants speed up mental and physical processes which can produce desirable effects in the short term by increasing levels of dopamine in the brain. Long-term abuse of these drugs can have significant consequences. So it is important for those who abuse them to get help as quickly as possible. Letter A, caffeine. What it is? Caffeine is a slightly bitter alkaloid or methxanthin in coffee, cola or tea, cocoa, soft drinks, and over-the-counter medication. Caffeine effects in general is mental alertness and general sense of well-being, acid producing in the stomach, elevated heartbeat and irregularities in heartbeat, and letter D is psychological and physical dependence. And the dangers of this is causes osteoporosis, gastritis, heartburn, ulcer, and cardiac arrest. Also alters brain electrical activity and dangerous to diabetics. And letter B, cocaine. What is cocaine? It is an alkaloid extracted from the leaves of coca plant. In its pure form, cocaine is white. It is made up of shiny look like crystalline snow. In powder form, it is odorless and bitter. Street names of cocaine is coke, crack, gold dust, heaven dust, speedballs. And how it be taken? It can be taken orally by mixing cocaine with a liquid or semi-liquid placed in a capsule or swallowed. Application by applying cocaine directly on the gums, underneath the tongue, or side of eyelid to prevent premature sexual climax. Some males apply it directly to the penis, females under the vagina. Letter C, injection, and letter D is sniffing by inhaling into the nostrils. The physical effects of cocaine is acceleration of pulse rate, increased blood pressure, and quickening respiration rate. Next is dilation, sluggish, reaction of eye pupils, slurred speech. Letter C is complete loss of appetite, intense feeling of thirst, and dryness of the mouth. Next is feeling of hyperactiveness, insomnia, constipation, fatigue, or cramps. Vomiting, desire to sleep, sense of smell intensifies. Next is psychological effects. What is the psychological effects of cocaine? No feelings, on inhibition, user tends to commit criminal. The desire for sex and varying sexual activities increases. Restlessness is irritability and anxiety of a feeling of well-being. Letter D is feeling of paranoia, I don't know how to pronounce it, hallucination, extreme depression, causes of psychological dependence. So the dangers of this cocaine is low dose by create psychological problems, overdose by cause delirium, convulsions, respiratory failure, or death. Repeated use of cocaine leads to addiction, and injecting cocaine with sterile equipment cause AIDS, hepatitis, or other infection.
Hello guys, I am John De Bagyo and I am assigned to this discussion about methamphetamine. What is methamphetamine? A stimulant closely related to amphetamine and ephedrine. Street names: shaha, speed, splash. How taken orally or intravenously. Physical effects: normal dose produce wakefulness, increased alertness, and feeling of increased initiative, restlessness, palpitation, dry mouth, hypertension, abdominal cramps, circulatory collapse, and cardiac arrhythmias. Nausea, vomiting, convulsion, coma, or death, or insomnia. Psychological adverse reaction. A. Anxiety reaction. Individual becomes fearful and tremulous with concerns about his physical being. B. Methamphetamine psychosis. Individual misinterprets other action, hallucinates, and become unrealistic, suspicious. Exhaustion syndrome. Individual feels intense feeling of fatigue and need to sleep following the simulation phase. Prolonged depression. Prolonged hallucinosis. Individual continues to hallucinate after drug has been metabolized. Danger. Excessive psychotoxic effects may lead to death, cause cardiovascular anomalies leading to jaundice and microcephaly among babies. Shabu. What is shabu? Shabu is a white odorless crystal and crystalline powder with a bitter numbing taste. Chemically, it is known as methamphetamine hydrochloride. Street names: Poorman's, cocaine, S, Shabs, Ubas, Shopao, Sha, Ice. How taken? By ingestion, inhalation, or chasing the dragon, sniffing, injection, smoke with a small pipe from a heated aluminum foil. Physical effects: chest pain, irregularity of heartbeat, hypertension, convulsion, and death from cardiac arrest, severe irritation of nasal passage, loss of appetite, and inability to sleep. Psychological effects: A. Irritability, irrational behavior, talkativeness, and loss of self-control. B. Anxiety reaction. Individual becomes fearful and tremulous with concerns about his physical being. C. Psychiatric consequences which can lead to manifestation of a full-blown psychosis similar to schizophrenia characterized by presence of paranoid delusion and audiovisual hallucination. D. Psychotic reaction. Individual misinterprets other action, hallucinates, and become unrealistic, suspicious. F. Difficulty in concentrating or remembering things, loss of interest in sex, and ambition. F. Ecstasy. What is ecstasy? An amphetamine type stimulant, MDMA. It is white, yellow, or brown in color, which a bitter taste and comes in the form of tablet, capsules, or powder. Street name, XTC, Adam, Essence, Herbal, or E. How taken, swallowing, or inhalation. Effects in general, exaggerate emotions, make heart rate and blood pressure hike up, dries mouth and throat, dilates pupil of the eye, stiffen arms, legs, jaw, cause of faintness, chills, sweating, and nausea.